about the Australia Biosecurity Futures Report that we produced in November of last year. And it was developed in strong collaboration with Animal Health Australia, Plant Health Australia, and the Centre for Invasive Species Solutions. So CSIRO has a futures team which develops reports that look into the future and try and define how the future processes are going to influence Australia in a number of sectors. These are a number of reports that they've produced over the last couple of years. And specifically today, I'm talking about two reports that were produced around Australia's biosecurity system. The first was back in 2014, which was very much a review focusing on focusing on mega trends and mega shocks that could impact Australia under a number of future scenarios. And then we produced a supplementary report or an additional report in 2020 that's focused very much on, what do we need to do? So what are the future states, particularly in the context of 2030, and what are system recommendations for the national biosecurity system in order to try and address them? So very much aligned to the thinking that Mark was talking about where are our future risks and how do we make sure we can address them. So the objectives of the report were to promote the importance of a strong biosecurity system, especially through a One Health lens, to create a sense of urgency across the biosecurity system in relation to necessary improvements and actions, and to inform policy, investment decisions, and future government biosecurity reviews. And we like to cheekily think that one of the impacts of this review is to some degree the increased government investment in trying to transform the national biosecurity system. So it involved an interview process where we interviewed over about 4 or 5 months. We introduced 56 individuals across 26 organizations, undertaking a total of 40 separate reviews. And the report was built on some fairly well understood information on what are the economic impacts of pests, weeds, and diseases to Australia. And I just thought I'd summarize these in this slide as a bit of background in the context of the background for the report. So we see the impacts of emerging infectious diseases and the impact that COVID had on our economy. And we would argue that because of Australia's biosecurity system, the economy was able to recover almost in the immediate quarter after we had a decline, because we were able to shut our borders and we were able to manage our biosecurity very effectively. And we've seen that unemployment rate too has come back, has dropped back to a much more sensible level. So huge impacts of potential diseases on our economy in the context of our GDP and our workforce. But also our national biosecurity system predicts a $66 billion agricultural industry and Australia's environmental assets that are valued at over $6.5 trillion. And a recent study that I was involved in has reanalyzed or done an up-to-date analysis of the costs of pests, weeds, and diseases to Australia. This is still in press. It's about to come out in the journal Neobiota. And this is a study that's collected all the data for the impacts of pests, weeds, and diseases going back over time. And so it's a temporal analysis as well as looking at different types of invaders and looking across states and territories and so on. And that report, the summary of that report is that pests, weeds, and diseases have cost Australia about $390 billion over the last 50 years. And there's been about a 6-fold increase in those costs per decade. And that the current annual direct costs are somewhere around $12 billion a year. So the report couched our future in the context of two different trajectories. So there's the business as usual trajectory and the transformational trajectory. And the business, we assess that the business as usual trajectory would lead to a disconnected and overly reactive biosecurity system, an under-engaged community, a growing decline in biodiversity, and a growing trade barriers associated with biosecurity and fragmented technology development. And one point of evidence to support that is the Craik review of the national biosecurity system back in 2017, I think it was, said that if we just keep the biosecurity system as it currently is, but just invest more money in it, we're going to be very quickly losing the benefit over time. So again, a strong recommendation that we need to consider transformational change, and therefore the transformational trajectory we suggest in the report could lead to a nationally coordinated system with a greater prevention focus, engaged and mobilized communities, improved environmental health, open and biosecure trade pathways, accelerated technology development and applications that can be sold, so we can turn biosecurity technologies potentially into industries that we can sell globally. So under those two trajectories, the report came up with 20 actions across 3 themes. I'm not going to go into each of the 20 actions, but I am going to cover briefly each of the 3 themes. And I'm sure for many of you, if you haven't already seen the report, these will be very familiar to you. So the first one is very much around system connectivity, of which we identified 2 components: digitized processes and data sharing, and domestic and international partnerships. So digitizing and data sharing between jurisdictions and sectors across One Health and across stakeholder groups of industry, government and community. And bit of background noise. Recognizing also too that there's a market access side to this too, that modernizing systems to reduce export compliance burdens and reduce biosecurity being used is a non-tariff trade barrier should be a benefit from this. And then we need to do this through strengthening our international relationships. So pre-border intelligence, and this is very much aligns with what Mark said in his neat diagram, and improving supply chain transparency, awareness of emerging technologies and policies, and being part of setting international standards, which again is very much part of the recent investment into by the government into biosecurity. So the second recommendation theme is around shared responsibility. This is an old, very familiar concept for all of us who've been around in biosecurity. I think it was first brought up in about 1996 by the Nairn Review, but it's still an overused and poorly defined term in biosecurity, and so we just tried to grapple with it in a bit more detail. So utilizing the full range of resources that can help keep Australia biosecure through shared responsibility, in addition to government's heavy role and the need that we talk to through community engagement, Indigenous engagement, and industry engagement. So for community, we consider this to be a 2-way engagement rather than purely an information provision, and citizen science programs supporting our biosecurity activities, but recognizing that they have limitations, and also education programs. Around Indigenous engagement, we recognise Indigenous Australians as Australia's largest land custodians, and our vision is to have Indigenous individuals and groups empowered through greater representation in senior decision making, more activities led by Indigenous organisations, as well as the continued co-development of science and technology opportunities with them. And through industry engagement, a big push for greater private sector management of biosecurity activities, recognizing that there's plenty of it out there, but we could do with some more. And so we need to have a better government industry engagement around the non-negotiables for each of the stakeholder groups in this space, and what kind of levy structure would meet everybody's needs for sustainable sources of funding to support the biosecurity system. And this is a diagram from the department that just illustrates how the different components of the system, the government, state and local governments, representative bodies, research organisation and individuals all have an important role to play in providing and supporting the national biosecurity system. So the third recommended theme is around innovation in science and technology. A lot of the work here has already started, is already starting to happen. We're developing new technologies. So in this report, we really took the perspective of how do you better support biosecurity technology innovation. And the 3 points we identified were: you need a set of biosecurity innovation priorities that are agreed across all jurisdictions and in a One Health spectrum and context. We need an innovation hub type concept to bring together SMEs and private investment to collaborate on these areas and potentially commercialize some of the technologies. And we need capability investments to make sure that we have good people who can develop the technology, but also use it in the context of a live biosecurity system. And we noted that there have been declines in some areas, particularly plant pathology, genetics literacy, disease therapeutics, and geospatial analytics. So those are the 3 themes. This diagram is just a better slide is just a better illustration of how we imagined a tech hub approach to support innovation, science, and technology. So, and it would involve a number of different players working together, including supporting the IP and including private investment to get it over the line. And the Department of Agriculture or the Environment already has a small biosecurity innovation program, which is kind of the first step in this direction. So we can certainly commend them for that. Now, let's get my slide. So in summary, Australia has a fantastic biosecurity system by international comparison, but the current system is going to struggle in 10 years. So we need a system rethink, and the rethink needs a greater One Health, cross-jurisdictional and cross-disciplinary discussion. And the recommendation themes above could help inform, or at the very least, structure these discussions. Australian biosecurity system, it protects our unique environment and internationally competitive agricultural export industries. It provides the platform for shared responsibility between government, industry, and community partnerships. But it needs to be transformed to meet growing risks and impacts, and scaled up. And just scaling up the current system isn't good enough. We need to innovate by defining, investing in technologies for priority areas. And we need a strong human, agricultural, and environment One Health approach. So if Australia wants to be the most biosecurity trading nation respected globally, transformative change is needed to get us there. Thank you very much.